PPE, or personal protective equipment, was not on the forefront of most people's minds, of course, prior to the COVID-19 pandemic. Now, as conversations continue about ensuring people on the front lines have enough equipment like gloves, masks, and gowns to keep them safe, we're checking in with local hospitals on the status of their supplies. KSBY's Melissa Newman explains why local hospitals so far say there is enough for now.
In order to enter local hospitals like this one, you now have to be wearing a mask in order to protect yourself and the healthcare workers inside. Now, while local hospitals say they have enough PPE or personal protective equipment, the California Nurses Association sees it differently.
Today at French Hospital, we have an adequate supplies of all PPE, personal protection equipment. But that can change.
Local hospitals say they're well equipped right now to protect healthcare workers on the front lines of the pandemic. Tenet Health, which owns Sierra Vista and Twin Cities Hospital, tells us in part, we can safely and appropriately care for our patients with the necessary supplies and equipment. We follow PPE conservation practices as recommended by the CDC. But the hospitals are seemingly at odds with the California Nurses Association, which says there's more that local hospitals could be doing. 6 days ago, healthcare workers with the association held a vigil in San Luis Obispo about the lack of PPE or personal protective equipment, telling us today, the issues we have with Dignity and all hospitals is the level of PPE that must be provided. Nurses must be protected so that they can remain healthy and provide care for the patients at French and other hospitals. Their health is being put at risk by French hospitals' current practices. The Nursing Association does not agree with the reusing of equipment like N95 masks, a practice they say is in place at local hospitals. But French Hospital CEO says they're following guidelines set by the CDC and the latest science available.
We continue to learn as the progression of the disease continues forward, and as we get more data, we adapt to that data, and we like to base our decisions on the best evidence-based science that's available to us.
The county's public health department says they have been ordering PPE at a steady rate since the beginning of the pandemic, and they've been able to fill the orders of local healthcare providers running short on supplies. In San Luis Obispo, Melissa Newman, KSBY News.
Governor Newsom says the state has been making strides in securing PPE for healthcare workers and has been able to distribute more than 41 million N95 masks in recent weeks.